Hello, good afternoon. I'll be your attending physician today. Nice to meet you. Just to confirm before we get started, can I have your name, please? I just want to make sure I have the correct record. Okay. And can I have your last name, too? Okay. And the nurse has given me your test results, and she's also taken your vitals. Am I correct? Yes, so it should be here as well. Perfect. All right, so before we go on, just a couple of questions. Do you feel, how healthy do you feel today? Do you feel any headaches, pains, symptoms, any of that sort? Yes, because I just want to make sure that as we go through the whole evaluation together, nothing gets mixed up in the whole procedure. And of course, if you have any underlying health issues that we need to take care of, I can also do that at the same time, so you don't have to come back to the clinic after. Okay, cool. So, do tell me if you are feeling anything weird with your system today, any symptoms, etc. Anything at all. Okay. Okay. And from a scale of 1 to 10, how bad are these headaches? With 1 being something that you can easily ignore, and 10 being excruciatingly painful. Okay. And did you notice if this is triggered by anything? Are there any other symptoms that come out from this? Uh-huh. Okay. So it's really just the headaches, yeah. And which part of your sort of head does it hurt? Like, does it hurt in the front, in the back, on your temples? Okay. So, have you noticed if it's triggered by anything of the sort? Okay. So you feel like it could just be tension, headache, stress? Okay. And is this something that happens on a regular basis? Does it happen once or twice a day, a week? Okay. So it doesn't seem to be chronic, which is good. Okay. We're gonna try and get you something for that. I'm gonna try and prescribe you something for it, aside from the, usual painkiller. Maybe that's all you need. Maybe that after we go through your results, I might see something that might be related to that, and perhaps we can, perhaps you need a different type of prescription, okay? So let me just go through your results real quickly. So you've gotten through, this is for your company's administrative files, right? Yeah, okay. So I have here your results. Your x-ray seems to be good. Your blood tests seem to be good. Nothing out of the ordinary. Other tests seem to be fine as well. Nothing too shocking. Nothing to worry about so far. Okay, this one seems to be good as well. Yeah, you don't have to worry about if you feel like it's like going borderline and stuff like that. For the most part, if I see something that's really beyond what should be the correct, what should be the usual healthy numbers, then I will tell you. So try not to overread when it comes to these tests. I actually have a mother who does that. But yeah, so far so good. You seem to be taking good care of yourself, which is good. Okay. And aside from your headache, I don't see anything that might be tied to it, so it might be, a little bit stress-induced. So hopefully you take care of that. You try to take other, perhaps any form of leisure exercise that might help you get rid of that tension headache. Because I don't want to outright prescribe some more powerful painkillers for you, especially if it can be alleviated with just a bit of any stress killers that you might have, any stress busters, Maybe watch a movie, take a walk, meditate, yoga, stuff like that. I tend to get a lot of workaholics into the office, which I understand. Okay. Actually, you might have missed something. I'm not sure if you also have the list. Can I have the list of the exams that you were to do earlier? Okay. Yeah, you actually missed one. Part of your requirement is to get your wellness test. Were you able to do that recently? Did you not just get the papers to the nurse? Right, well, unfortunately, I can't really clear you unless you finish these wellness test, because it is part of your company's file, so we are going to have to go through that. Any reason why you missed it? Did you just forget? Are you trying to avoid something? Okay, just forget. It's fine. Most people try to avoid the same test as well because it's awkward, and well, not a lot of physicians actually know how to do it well and properly. So, luckily for you, I'm quite experienced when it comes to these things. So, there's not a need to worry. We can choose to do your wellness test now, or you could wait and suffer a longer line, and perhaps a physician who is not ready for this type of test. You'd like to do that now, or no? I personally highly recommend that you do it now because, first and foremost, I don't have any more patients coming through, and so I do have the time to do so. And second of all, it's not going to be much of a bother for me. In fact, I quite enjoy providing these tests. You'd be surprised. You will know a lot of things just by making someone sore twice. You don't have to worry about a thing. I will be able to take care of you, and everything will be discreet. All you need to do is sit back and relax and let me take care of everything. Trust me, it's not going to hurt. I know that previous wellness tests might sort of traumatize a couple of patients, because doctors tend to be a little bit more clinical when it comes to these things. But personally, I have worked with a couple of actual physical therapists and people in the industry, if you know what I mean. And so I'm properly trained to make sure that you feel nice and well, and that this whole, experience is as seamless and as painless as possible, and as natural as possible. So you don't have to worry about anything. Why don't you go and lean back on the bed? Maybe prop a pillow or two. I do believe I have an extra pillow over here, so you have the proper angle. There you go. Get yourself nice and comfortable. Alright. But yes, as I was saying, all you need to do is just relax and let your doctor take care of you. You're in good hands. Trust me. I did sort of forget, but it's a good thing that you're wearing a buttoned-up shirt, because I could just easily unbutton this. Relax. Don't worry about it. It's gonna feel much more comfortable the less restricted your clothing is. So let me just slip this in and out. Alright, good. And actually, let me take care of my coat as well. Okay. Feeling much better? Just relax. Deep breaths if you're feeling a little bit nervous. But trust me, I'm a professional, and I know exactly what to do to make you feel good. Because you deserve to feel good, yeah. You agree with me? here, let me just start unbuttoning your jeans. And drop this down a little bit. Tell me if you prefer taking your entire, or you're okay with just this. Personally, for me, I prefer that you take it completely off because you can get to relax as much as possible. Okay, let me just slip these off for you. Don't move. It's okay. I actually like it when I get to take things off. In the bedroom, I mean. That's it. Just shuffle a little bit for me. Perfect. Okay. I'm just going to put these right over here. You'll be able to get it afterwards. Now, let me take care of me too, because I know one thing that's going to help you feel good. Let me just take this shirt off. There. You like what you see? Well, I never try to guess what patients might like to see if I ever have to make the tests, but it's always nice if I get to wear something that a patient particularly enjoys. It makes my job easier that way. Regardless if I'm wearing something good or not, my intention is always to make sure that you feel good so that I can also get the best results. One of the first things I do when I look into my patients is to see how their bodies might react, especially when I start moving my hands down their bodies, see if they feel or they exhibit some goosebumps, a little bits of tension. Yeah. Sometimes I'd whisper into their ear and see their shoulders raise, any reaction from it, because a body that reacts well to any movements and actions is one that's a healthy one, you know? One that reacts with perfect reflexes. It's like one of those when you test with the little hammer that hits your knee and then your knee just jerks up. Yeah, I want to see if I could get your nice, wonderful to also jerk up with anything that I might do to you that I expect would be something that you might enjoy. Well, now let's see how your body might